I'm Nine Health expert Dr. Payal Kohli, and today I have the pleasure of sitting down with Dr. Rohini Sharma, infectious disease expert from North Suburban Hospital, to talk about something they're all worried about, the Twindemic, the onset of the COVID-19 pandemic and the oncoming flu season. When COVID-19 pandemic really hit in February and March, we were at the end of the flu season. But now we're facing the opposite trajectory for the flu season, where flu activity is really starting to rise and COVID-19 activity is still quite rampant. So what advice would you have for us this year as we head into the flu season on how we can keep ourselves safe?
It is important to know the differences between these two viruses, COVID-19 coronavirus and flu virus. Influenza is extremely contagious. It has a very short incubation period, which is the time from acquiring the virus to developing the symptoms, and a very small serial interval, which is time between two successive cases. And this means that influenza can spread faster than coronavirus. And further, the transmission of influenza is mainly driven by the pre-symptomatic period, the 3 to 5 days of pre-symptomatic period when the patients are asymptomatic. And that's when the influenza virus is driven most. And also it is likely in the next few months that the flu viruses and the coronaviruses are going to co-circulate. And it is all the more important to not overwhelm our healthcare systems and to be vaccinated against flu virus. And we have an excellent vaccine for flu virus. And I recommend getting the flu vaccine and keeping yourself safe.
A lot of people are thinking, well, I'm wearing the masks, I'm washing my hands, I'm doing the physical distancing. And since both viruses are really spread through droplets and direct person-to-person contact, why do I even need to get the flu vaccine, especially if we're doing all these measures? And for some people who are, mostly at home and not really having a lot of contact with others, do they still need to get the flu vaccine? What are your thoughts?
Yeah, I understand social distancing and following good hand hygiene and wearing masks, and since both of the viruses are respiratory viruses, this will control the flu virus as well. But following infection control measures are not 100% all the time. People do get tired of wearing the mask all the time or washing their hands, and that one time your mask slips off or one time you don't wash your hands could be the time you acquired the influenza. And that's the preventable disease.
Let's talk a little bit about the efficacy of the vaccine, because a lot of people say, I got the flu shot and I still ended up getting the flu, or the vaccine never gets it right. So tell us a little bit about how vaccines are made, how they're designed, and how do we know what strain of flu is going to happen this year?
So it is likely that flu viruses and the virus that causes COVID-19, coronavirus, is going to be spreading together in the next few months. And our healthcare systems are going to be overwhelmed with admissions for both the kind of infections. And this means getting a flu vaccine is all the more important. Now, we know that influenza virus, it mutates. And new vaccines produced each year are based off the last year's match from the circulating influenza viruses, and global surveillance data is available for them to formulate a vaccine. The whole process takes around 6 months, and then the vaccine is ready. And I understand sometimes the match is not 100%, and you might have a reduced efficacy of the vaccine. Even in a reduced efficacy of the vaccine, there is a milder disease and decreased hospitalization. Even if you end up getting influenza, chances of getting hospitalized are less. And if you get hospitalized, there is a reduced risk of an ICU admission and in-hospital mortality and overall length of stay. So overall, influenza vaccine, even with reduced efficacy, is very, very effective.
I think that's a really great point, which is that it's really not an all or nothing. And even if you do end up getting the flu, it's probably going to be a milder version of the flu and you'll recover faster. It's really like flexing your immune system and training it so that it can be better.